Nursing 234, skill number 2. We're going to learn how to use the volutrol, or the volutrol, that's another name. You'll see these a lot on pediatric units, and I'll show you how to use these. Also, I just want to mention the mini infusion pump. We don't have one of those here at HLGU, but there will be a couple test questions coming from that, so don't ignore that information. It's very important. So I'm going to grab some gloves and perform hand hygiene as I enter the room. And Mr. Smith's been doing a great job today that when out his little son got sick. Little Smith. And Little Smith's a pediatric patient, so you'll see these used a lot on pediatric patients. And Little Smith needs 25 mils an hour of normal saline. And we don't want to give a large amount at one time. We just want to give 2 hours of fluids at a time. So we'll fill this to 50 because 25 times 2 is 50. So we'll get 25 mils the first hour and another 25 mils the second hour, then we'll have to fill it again. So I'm going to go ahead and clamp both of these. The nurse before us forgot to place the volutrol when she primed the fluid. So I'm going to get the fluids down. I might have my assistant hold this for a minute. Okay, so I got my volutrol and I have both of these clamped. And I'm going to say, Little Smith, how's your IV site? And he says it's great. And when you go to practice, there'll be this little twist cap. We're going to probably reuse these because these are actually really expensive. So we'll reuse the caps. You're going to spike it here. And then this is clamped up here. You're going to take this and then you're going to spike your fluids. And you're going to hang this up here. And we're going to have to lower this pump or raise the pole too, and because of all the extra tubing. You're going to open this clamp and you're going to let it flow to 50. And then you're going to clamp it off. Now, if Little Smith needed medications, we could swab this port and add medications to this and dilute it with this medication. But Miss Little Smith doesn't need any medicines. If you're over a couple mils, you're still safe. You won't fail this skill. I'm going to unclamp this. I'm going to turn on my pump. As I'm turning on my pump, I'm going to ask Little Smith his name and birthday because we're giving him new medicine and I haven't been his nurse yet today. And Little Smith's, we're going to say, how's your IV site? Does it hurt? Any edema? It looks really good. And there's no wetness, no moisture around it. And since it's just IV fluids, we're going to type in IV fluids and hit OK. And our rate ISO is 25, hit OK. And we're going to give a total of 50. So we're going to hit OK. I've unclamped this and I've clamped this. The clamp actually goes up towards the primary bag when you close it, so just be aware of that. And you're going to hit run. It's going to ask, our little drip chamber is a little full, but that's okay. Are there any drops flowing? This may take a minute because we're only given 25 mils an hour, so it's not going to be super fast. And you will be standing here for a while for 25 mils, so an hour. Well, there's half a drop coming out, but we only count whole drops. And your quiz will have 15 questions. Oh, there's that drop. And 5 of them will be math. So you just hit yes. And then you say, Little Smith, if your IV starts to hurt, let me know. And you can label this, but you would want to change this every 96 hours if it's with the primary, every 24 if it's intermittent. So I'm going to turn this off because he's got all the fluids he needs. But if you have any questions about the volutrol, please stop by and see me or email me. Thank you.